For so long in aesthetic medicine, we've been focused on the scaffolding, right? The collagen, the elastin, the very structure of the skin. But what if the real key, the better, more predictable outcomes, isn't just in the bricks and mortar, but in the living garden right on the surface? Today, we are diving deep into that often overlooked ecosystem, the skin microbiome, and we're going to explore how it's about to redefine your entire practice.
Yeah, this quote just nails it, doesn't it? For any ambitious practitioner out there, understanding this microbial world isn't just some interesting side topic anymore. It's quickly becoming the new standard of care. This is the variable that can unlock truly superior outcomes and set your practice worlds apart.
So in this explainer, we're going to bridge that gap from knowledge to action. First, we'll reframe how we even see the skin itself. Then we'll apply that to conditions you see every single day. After that, we'll build your new toolkit, and finally, we'll map out the concrete steps you can take in your clinic, like tomorrow.
Okay, so let's start with the most fundamental change of all. And this isn't just about adding a new product to your shelf. It's about a complete and total shift in perspective, from seeing the skin as just inert tissue to understanding it as a dynamic, living ecosystem.
Now, what's so powerful here is the shift in language. Look at that. We're moving from treating a wound to managing a recovering ecosystem. The old view was purely structural. This new ecological view, well, it acknowledges that the trillions of microbes on the skin are active partners in everything from barrier function to the immune response.
And this is exactly why it matters in your clinic. Every single chemical peel, every laser resurfacing, every microneedling session you perform, it isn't just affecting keratinocytes. You are directly altering a microbial habitat. And what that means is our post-procedure protocols have to evolve. They need to support the recovery of this entire biological system, not just the cellular one.
This number, pH 55, it looks so simple, right? But it is everything. This is a critical functional threshold for the skin. So why is it the sweet spot? Well, because it creates an acidic mantle that favors all the beneficial microbes, like S. epidermidis, while actively shutting down pathogens like S. aureus. A single wash with an alkaline cleanser can literally wipe out that entire defense system.
Okay, so let's bring this down to the ground level. How does this new way of thinking actually change what you see every day in the clinic? Well, the truth is, many of the chronic conditions you treat, from acne to rosacea, are at their very core expressions of microbial imbalance. We call it dysbiosis. Let's look at a few common examples. You know, for decades, we've all pointed the finger at one species, Cutibacterium acnes. But the truth is, it's so much more nuanced than that. This bacterium is unhealthy skin too. The real culprit is a specific aggressive strain, phylotype IA1, that triggers inflammation and builds these protective biofilms. So our goal shouldn't be to eradicate it, but to rebalance the community. So what does this mean for our treatments? Well, it means we have to get way more precise. Broad-spectrum antibiotics are a sledgehammer when we really need a scalpel. So we need to be setting firm end dates for those antibiotics, maybe 6 to 8 weeks max. We should be using tools like short-contact benzoyl peroxide that don't trigger resistance. And critically, if we have to use systemic antibiotics, we should be pairing them with oral probiotics to limit the collateral damage to the gut-skin axis.
Now this is a total game changer for atopic dermatitis. We used to think of Staphylococcus aureus as just a secondary infection, a complication that happens after the flare-up. But we now know that in up to 90% of cases, the colonization by S. aureus happens before the flare. Its toxins just chew up the barrier and lock in that inflammatory cycle, making it a primary therapeutic target.
And what about those really frustrating, treatment-resistant rosacea cases? We all have them. It might be time to look deeper, specifically at the gut. There's a really strong clinical link between rosacea and SIBO, small intestinal bacterial overgrowth. In some studies, treating the SIBO has cleared up rosacea that was totally unresponsive to anything else. This is the gut-skin axis in real-world action.
All right, so now that we have this new perspective, what can we actually do with it? What are the tools you can use? This next section is all about building your practical microbiome toolkit. And we're going to start with the essential language for talking about and choosing modern skincare. So let's break down the lingo. You're going to see these terms everywhere: prebiotics, probiotics, and postbiotics. Prebiotics are basically food for the good microbes already on your skin. Probiotics, at least in cosmetics, are usually lysate, extracts of beneficial bacteria that still have biological effects. And then you have postbiotics. These are the helpful byproducts those bacteria produce, like lactic acid. They're super stable and act like a pre-built support system for the skin.
Okay, this right here, this is probably the single most important place you can apply this knowledge, like today. After any procedure that compromises the skin barrier, there's a critical window of opportunity. Your goal isn't just to hydrate and protect the recovering cells, it's to actively speed up the recolonization of that entire protective microbial ecosystem.
So what does a modern post-procedure kit actually look like? Well, it starts with that crucial pH of 5.5 in a gentle cleanser. It has to include a solid barrier cream with ceramides, but here's the key addition: a serum with actives like prebiotics or postbiotics to really support that microbial recovery. And of course, it means absolutely no known disruptors like harsh alcohol-based toners.
All right, we've covered the why and the what. Now for the how. This final section is all about the immediate, concrete actions you can take to make your clinic a truly microbiome-literate practice.
And look at how straightforward these steps are. Just auditing your patient's cleanser pH. That's a zero-cost, high-impact intervention. Reevaluating every antibiotic prescription, asking about gut health in your rosacea cases, and cleaning up your post-procedure kits. These are all changes you can literally implement tomorrow.
You know, the market is flooded with microbiome-friendly labels, so how do you cut through all the marketing fluff? This simple 3-point checklist, it's a powerful filter you can use to evaluate any product you're considering for your patients or your practice. Okay, here's your 3-point mental checklist. Question 1, does it preserve that all-important pH balance? Question 2, scan the ingredients. Does it have known disruptors like SLS or high-concentration alcohol? And question 3, this one is crucial. Are the good ingredients actually there to do something, or are they just for marketing? Are they at functional concentrations? This is how you separate the science from the hype.
And really, this is what it all adds up to: becoming a microbiome-literate practice. This isn't about you becoming a microbiologist. It's about making this ecological perspective a fundamental part of how you consult, how you prescribe, and how you recommend products. This is the new standard of care.
And that's really the bottom line, isn't it? We're not waiting for some future scientific breakthrough. The evidence is here. The tools are available. The only thing standing between current practice and best practice is integration. And that is something you have complete control over. So I'll leave you with this one single, powerful question to carry into your very next consultation. Ask this about every product, every protocol, every recommendation you make. It completely reframes your role, from simply treating skin to actively stewarding the delicate ecosystem that keeps it healthy, resilient, and truly beautiful.